It is my esteemed honour to welcome our speakers today. This is session 15, and we are going to be having a presentation about one of my favourite subjects, which is water birth. So first, I'd like to welcome Professor Dr. Hayaat Gomma, who's a full professor at Ahmadu Bello University in Nigeria. She earned her PhD from Cairo University in Egypt in 1998 and has extensive international research and experience across many countries of the world. She was head of the nursing science department at the university and is currently the postgraduate program director. She's had many leadership roles and has also assisted in development project for nurses in Egypt's Ministry of Health. She contributes to healthcare initiatives in Nigeria and is an executive member of lots of related projects. She reviews for the International Journal of Gynecology and Obstetrics and is an ambassador to the Spina Bifida and Hydrocephalus Care Foundation. She also consults with USAID. She has played key roles in curriculum development and community health education and received numerous awards in Egypt and Nigeria for research excellence and has published extensively in the field. She is also recognised by the Journal of Paediatric Nursing, and it is such an honour to have Professor Dr. Hayaat Gomma with us today. Next speaker is Mardiya Adamu. Mardiya is a highly committed and compassionate midwife with over 10 years of continuous service in maternity care. She graduated in 2015 from the above-mentioned university. She's a nurse, a midwife, and a public health nurse with a strong foundation in clinical excellence. She also has a Master of Science in Nursing, where research focused on effects of intimate partner violence among pregnant women, and her work highlights the urgent need to address gender-based violence as a critical component of maternal health care. She is also engaged in assessing midwives' knowledge and attitudes in midwife-patient relationships, and this reflects this year's theme. She believes that meaningful connections are at the heart of effective midwifery care, and she is honoured to contribute to the global dialogue of maternal health at VIDM 2025. Our third speaker is Salamatu Umar. Salamatu is a compassionate nurse midwife and a lecturer in the Department of Nursing Sciences at Gombe State University in Nigeria. She has an MSc with a specialisation in midwifery and a Bachelor of Science from Ahmadu Bello University and a postgraduate diploma also. She's a registered nurse, midwife and public health nurse and has received many awards in Nigeria, and she is deeply committed to maternal and child health. She also coordinates the paramedic programme, and she has played key roles in academic and clinical training and has experience in maternal health, emergency and disaster nurse education. She's also an examiner for the Midwifery Council in the past few years. She's known for her leadership and strategic planning, and she has authored articles in peer-reviewed high-impact journals and has presented scholarly work both nationally and internationally. It does give me great pleasure. Thank you so much. Let's welcome our esteemed speakers. Thank you so much. Over to you.
Okay, thank you so much, Jane, and all. Okay, thank you so much for this long presentation. Thank you so much. It's a great pleasure to us to join the virtual International Day of Midwife VIDM this 2025 conference. This is not the first, and I'm sure it's not the last time. I would like to say thank you for all the organizers and all this is the stuff before all this, the success of this conference. You know that as the presenter, they are present us. Me, it is Prof. Hayaat, and we have Salamatu and we have Mardiya for this presentation. Our topic is the perception of water birth. It is a mixed method study in reproductive to reproductive women in Gombe State, Nigeria. Next, please, Salamatu.
Hello, everyone. Hello, everyone. Good morning, afternoon, and evening, depending on where you are. I am Salamatu Umar. The video does not open. Okay. I am Salamatu Umar, a nursing lecturer and maternal health advocate from Gombe State, Nigeria. With me are my co-presenter, Prof. Hayaat and Mardiya. We'll be sharing our finding from a mixed method study on the perception of water bath among reproductive-age women in Gombe State, Nigeria. Prof, could you please tell us a brief background about water bath?
I think with midwifery new model and all this innovation in midwifery care, we just think about it. What is the important, or how the women in reproductive age they are think about it, water birth, and this is the idea. It is come for us, and we check how they are, what is their knowledge, and what is their perception toward this is water birth. And we just know started to search what is water birth. Water birth is the delivery on warm water, and we have for this is hydro labor with the burn relief, and the hydro birth with birth in water, and they are the main benefit here. It is mainly for all this is burn reductions, and also to the clean labor and the clean delivery.
Yeah, next slide. Thank you for giving us the opportunity. Unfortunately, it is very rare in Nigeria due to infrastructure issues and lack of trained personnel. Globally, water bath is and particularly in Gombe State, there is limited adoption and perception about it remain unclear. Yeah, Salam, can you share the specific aim and objectives of this study?
Yeah, Mardiya, indeed, the aim of this study was to assess a perception of water bath among reproductive age women in Gombe State. And the specific objectives were to explore women's perception towards water bath, to assess perceived benefits of water bath by the women, and to determine maternal and neonatal risks as perceived by the women. Prof, will you please tell us the significance of this study?
You know that during our study, when we put it our objective and when we put it our research objective, we just think about it. If this research it really had a good significance for this one, and when we are search and what are expected from this work, we are expected that the first one significant here, it is the woman in reproductive age. We need all this, the woman should to be aware about it, what is labor and what is the water birth, and will exact for her what is the benefit of this one. So we are expected the woman, she will get more information about this water birth. And also we have in the other hand, what is the healthcare provider, which is the nurse provider or the midwife. So the midwife, we are introduced, this is water birth, we are introduced to the healthcare provider, especially the midwives in all this is the governmental and non-governmental or private hospital, about this is innovative model of labor birth. And also we have this is the policymaker, which is really the constitute the policy just to ensure low maternal mortality and they ensure quality of care and the safety labor for this one. And all of this one, it will be affected in the community when they are community with low mortality and low morbidity. I think it will be a good benefit for us. And this is what expected our significant for our strategy.
Yeah, we used a sequential explanatory mixed method design. We surveyed 418 women and conducted 15 in-depth interviews. Tools included structured questionnaire and a 5-team interview guide. Salamatu, will you tell us how did the sampling help ensure representation throughout the study?
Yeah, of course, we've selected we've selected local government areas across Gombe North, Central, and South zones, ensuring fair inclusion and a mix of urban-rural perspective. This added a robustness to our analysis. Prof, how was the data analysis once collected? How do we analyze the data?
Okay, please, can you move to the next slide, please? You see, material method we are yet. This is the setting, and without the setting, it was Gombe State here at the Salamatu share expected. Next slide, please. Okay, you know that we have, as we thought, it is mixed design, we have quantitative and the qualitative data. The quantitative data we use SPSS version 27. For this quantitative data, we did the error, it is 0.5%, yes. And while the thematic, we have 3 thematic regarding the thematic regarding this is qualitative data, and as we thought, we use the in-depth interview for this to collect our data, and it will be the thematic, and we can see the thematic, it is really we have big diversity between how the women they are perceived. Some of them they are really happy, some of them they're afraid, and I think maybe we'll see the result, it will be really astonishing, and we are not expecting that the result it will be like that. Thank you.
Yeah, we obtain ethical clearance before commencing the study. Participants gave informed consent. Confidentiality and privacy was strictly maintained throughout the study. Could you please walk us through the key numerical findings from the quantitative data? Salamatu.
Yeah, our findings revealed mean respondent age of 24 years. About 63.9% had a monthly income of greater than 30,000 naira monthly, and more than half of the respondents were tertiary educated, and also 77% of the respondents have a positive perception of water bath. So, Prof, could you tell us what stood out most from the interview?
Of course, you know that, as I said, in our method of data collection, as we done, the perception, the first theme, it was how the woman she is perceived. This is water birth, and we collect a lot and many different till we are saturated our data. Stopped one woman, she said, yes, I wanted to try it, and this is early women, this is early age, the reproductive age. That is the meaning. Oh, this is the young adult, especially the primary or the first, the primary or the have only one gravida, they are really interested, you know, because this is the adolescents or this is the early adults. I think they are just highly enthusiastic about the labor and highly enthusiastic about how to, you know, to conduct or to test or to experience this is water birth. But some of them, they said, not for me. And they said, no, how I can do it, this one? I am not a fish. How I can put my baby in water? You wanted to baby to my baby is the, oh my God. So you have positive perception and you have negative perception toward this water birth. And this is the natural of the human, especially when we are dealing with something is very special and this it is very precious when they are women after 9 months and she lost her baby and it will be not good. Come, next slide, please.
That's a powerful statement, Prof. Some women mentioned pain relief, cleanliness, and peaceful environment.
Next, please. Next slides.
Yes, one woman said less contraction, less pain, a clean baby, and sound sleep. Yet very few had prior knowledge of these benefits. What about those who had concerns? What risks did they identify?
Yeah, exactly, Mardiya. When we asked them about the risks, the primary concern was neonatal drowning or water aspiration. For example, a respondent said, water can enter the mother, increasing the risks of newborn death. This highlights the critical knowledge gap. Prof, could you summarize the main findings of our study?
You know that the risk factor, you see, this is here, I said, this is the perception and this is qualitative data. It was really and very interesting. It is very interesting when we are discussing about this water birth, as I said before. you know that some of them, they are that I'm feeling from my baby it will drawing, I'm feeling for infection, how I can all my blood, or this is the one secretion, or maybe sometimes defecated, I'm defecated when I'm being down, it will get infection. Maybe the water itself, maybe it is discomfort, maybe it is cold, maybe it is hot. All of this perception, they are got it from the woman during her in-depth interview. Next slide, please. Next slide, yes. At the end of this one, what we have to conclude? We can conclude that water birth, it is not difficult, especially in low resources, and it will be so easy to apply. And we have to work it together. Midwives, they can make innovative. Now WHO, they are working in innovation. They are working in artificial intelligence. They are working on virtual reality. They are working in all new model just to ensure the quality of care, safety mother and safety patient, safety child in newborn. And I think this one, it will be very good. We have the women, she had little of them, they have some knowledge about the water birth, and many of them, they are controversial about this, is what is the benefit, what is the risk, and what is the advantage of the water birth. But we are expected that we are applied this one. We are just calling here from this scientific conference, especially midwife, and we are really just call for action. Why we didn't introduce innovative water birth, and we are innovative. All this is the nursing practice for the women. Next slides. So we have to disseminate the culture of using water birth for labor. It is mainly for burn relief, and we have to increase the education and the awareness for all women, especially in antenatal clinic. And this is very crucial about why we are take care of women. We are started to take care of women during this is antenatal clinic classes, antenatal clinic visit. We need this one. We need to prepare the woman just to enjoy her pregnancy and enjoy her labor, and they go back peacefully and safely from her barbarian. And we have also we have to train the nurses and all this midwife regarding how to use this water birth. Thank you so much, and I'm so happy we are at the team. We are so happy that we are present our presentation here, and I hope that if anyone have any question, we are ready to answer. Thank you so much.
Yeah, thank you for joining us.
Thank you so much.
Thank you all. I'll have Nakachu monitor the chat, and I would like to ask a question if that's okay. Could you tell us which settings were you talking about water birth? Is it in the hospital? Is it in birth centers? Is it at home? Is it everywhere? Which settings were you discussing water birth for your clients and families? Thank you.
Salamatu?
We are talking about at hospital setting. We want it to be implemented in our hospitals in Gombe State because we like it. We don't even have the equipment. So that's why we are carrying out the research. Hospital setting.
Thank you.
Yeah, anyone from the participant, if you have any question, you can unmute your mic and you can raise your question to the speakers. And you can also put the question in the chat and you can reflect to the speaker.
Okay. Any more questions? We can answer any more questions and do all. Maybe I will have to add something during our practice session. I think our co-facilitator, they asked us about it. What about if it wanted to implement this water birth in low resources or middle income country? I think it will not a big issue, and it will be so easy. The issue here is all this is the conductive vaginal delivery I think it will be very good. And it is not what we need. We need this is plastic swimming pool, and we need water. And this is to ensure that to prevent the infection. This is water. It has to be boiled before, and after that we leave it to be warm, and we allow it to the women to sit in this one, and they encourage her and use it now. This is the water pressure. The water pressure, it will be modernized and this is modified. This is the pressure for enter and outside. I think it will be very good. And the woman itself, she will not feel heavy. She will not feel that she is flowing in the water, and it will be reduced her labor pain. And it is also, if she wanted to urinate this in the swimming pool, she will not feel shy, because all the secretion, it is come out, nobody will see this one. And based on our experience, when the woman, she's really feeling exposed like her own, and this is like position, many of the women, she really feel shy, and they feel no, this is not good, and all the time she just control her leg together just because to protect herself from her privacy. I think it is not difficult to apply this water burst in low resources setting and low and the middle income country. Any more questions?
Yes, one question from the chat box. Am I audible? Prof. Hayaat.
Yes, sir.
Yeah.
What is the question? Okay.
Yeah, from the chat box,
Do you
did you have consideration for the water? Did you need to install a filter? Yeah, I think we got it from the introduction.
Okay. I found this, Linda. She put it one question here. Do midwife in Nigeria have experience in water birth? This is one from our recommendation, Dr. Linda. You know, because we mentioned that this is the new model of delivery here in Nigeria, and we put it in our recommendation. Disseminate the culture, how we can disseminate the culture of the water birth, and also we are recommended that we need the midwives and the healthcare worker in these tertiary healthcare facilities, and this especially in labor ward. Why we have to train them how to conduct this one. Do you have consideration for water? Do you need in salt filter? I think this is, as I said to you, we are not need filtered here, because if you wanted to make the pure water, we have to boil it first. And I said that we have to boil first the water, and after that, once we get boiled, we can leave it to be warm, so the woman, she will be able just to sit in. So it will not very hot and it will not very cold, and I think it will be like we are making vaginal or perineal care. So it will be the water, it will be very good. Okay, Hina, great pieces of research moving best evidence. Thank you, Elisa. Thank you for your comment. Thank you so much. I hope that any question again.
Yeah, what is the temperature for the water that we use for water birth?
What is the question, please? I'm not hearing you well.
Yeah, what is the temperature for the water?
The temperature, it is warm temperature. It is warm temperature, you know that what we have it. Maybe we adjust the women. Yes, this water is okay for you. It is comfortable for you. When the woman is comfortable, it is not certificate degree centigrade. This is the woman, yes, I feel comfort with this one. So we are, we have to add some hot water, or maybe you can add more cold water. When the woman is satisfied with the warmth of the temperature of the water, it will be so easy for us. And I hope that maybe this project, maybe we can try to implement it and to put it in evidence way. Maybe we can try it and it will be working. And it is just a call here. If some of you here, they have too interested in this water birth, maybe we can go together and make it impact research and outcome research. Why we do it? Why we just implemented this one in a small piloting, and they will find what is the result. And it will give it to us. Really, this is a benefit for the women to do it, to apply it now. Just this is not a good idea, and we have to neglect it. So it is just we are in our program here on our paper, we just discuss what is the women knowledge and what is the women perception. The women have some knowledge and some controversy of their perception. So maybe it will be volunteer women if she wanted to test or to experience this water birth. I think it will be good and we'll get a good result, and we'll add it to our nursing, maternal child health nursing specialty.
Yeah, the temperature for the water bath is usually 36 degrees to 36.9, 36 to 36.9 degrees. So we usually measure it with bath thermometer. So in the low resource country settings like Nigeria, we use the palm of our hand to measure the hotness, the degree of hotness of the water. So that's the temperature.
Do you have any special suggestion on the infection prevention, especially the low resource settings?
Sorry, Nekeshu, I'm not hearing you well.
Yeah, what do you suggest on the infection prevention when we do the water birth, especially for resource limited countries?
Infection prevention. I think this is very fine. I think one of the diseases now, because we think about this one. Once the woman, she's put her baby and she's not yet to remove the placenta. I think maybe we have to include this one in our research, because once the woman, she's put her baby, now her uterus is open. So I think we have, I'm not thinking about this one really, but maybe after this one, if we are separate the placenta and put it the woman. And I think that the new trend here, we are avoid all this is antibiotic after this postpartum period, because this is some of the procedure on some medication we give her some mesogen or oxytocin just to ensure that the woman wombus is really fully contracted, and we can give her some of this is the Velocef or some amoxicillin just to prevent the infection. I think this one, it is really not clear. This is not clear for us really, but I think maybe we have to extend our project. I think we can extend our project if it really got a pilot about this is one, and it will be very good. Thank you. Over.
Thank you so much, all the speakers, for your nice presentation.